You've seen these, right? You're scrolling online and boom, there it is, this super simple chart. Common diseases on one side, medicines on the other. And you think, awesome, this is exactly what I need. It looks so clean, so helpful. But is it really that simple? Is it maybe a little too good to be true? Well, that's what we're going to do today. We're going to break this thing down and see what it's really telling us, and more importantly, what it's leaving out. So here it is. You've probably seen something just like this floating around. Disease on the left, medicines on the right. Looks simple enough, but I want you to look closer, right at the top. You see that tiny little disclaimer? For education purpose only. That one little phrase is our first big clue that there is way more to this story. And look, let's just get this out of the way right here, right now, loud and clear. This whole explainer, and especially the chart we're looking at, it's all for your information. This is absolutely not a substitute for real, professional, medical advice, diagnosis, or treatment. Your health is your own unique story, and it deserves the expertise of a real healthcare professional. Seriously. Okay, so with that very important disclaimer fresh in our minds, let's dive in. We'll start with what looks like the most straightforward part of the chart, everyday elements. You know, the stuff we've all had to deal with. The answers should be simple, right? Well, let's see. First up, the absolute classics, a fever and the common cold. Now, the chart offers this whole buffet of options for a fever, paracetamol, ibuprofen, and it makes them all seem kinda interchangeable. But are they? Nope, not at all. One might be really tough on your stomach, another could be a bad idea if you have liver issues. The chart doesn't say a word about that. It just gives you a list, making it seem like it's an easy choice. And it's the exact same story for a cough or diarrhea. The chart just lumps everything together. For a cough, you see suppressants, which literally stop you from coughing, right next to expectorants, which are meant to help you cough stuff up. They do the opposite thing. And for diarrhea, it puts simple rehydration salts next to some pretty powerful antibiotics. Using the wrong one isn't just not helpful, it could actually be harmful. But again, the chart just presents them like a simple menu you can order from. Okay, so even for what we think of as simple problems, the chart oversimplifies things a lot. So now, let's raise the stakes. What about chronic conditions? These aren't just a bad week. For a lot of people, they're a lifelong journey that requires really careful navigation with a professional. So you look at something like high blood pressure or diabetes, and the chart gives you guessed it, another list. But treating these conditions is like tuning a really sensitive instrument. A doctor might start with one medication, then add another, constantly adjusting the dose based on your blood work, your lifestyle, how you react. It's a partnership, not a one-time choice from a list. It's the same deal for asthma and epilepsy. We're talking about powerful medications with some serious side effects. The right dose can be absolutely life-changing. The wrong one can be genuinely dangerous. A specialist works to fine-tune this stuff over months, sometimes even years. The chart's simple list just completely papers over that whole intricate, careful process. Now let's shift gears and look at the heavy hitters, those acute and serious infections. This is where getting the right medicine at exactly the right time is absolutely crucial. Okay, for tuberculosis, the chart actually shows the right cocktail of drugs, but it misses the most important part. You have to take them for months, under strict medical supervision. And for pneumonia, it lists a bunch of antibiotics. But here's the kicker. Pneumonia can be caused by bacteria, or it could be a virus. An antibiotic does absolutely nothing for a virus. A doctor has to be a detective to figure out the cause before they can even think about prescribing the cure. And finally, take a look at malaria and typhoid. These drugs are like guided missiles, designed for a very, very specific target. Using the wrong one is like sending that missile to the wrong continent. It's not going to work, and it's just going to make a mess. This is where the idea of just pick one from a list goes from being unhelpful to being truly dangerous. So far, we've just been reading what's on the chart, but the real lesson here isn't what's on the chart. It's what the chart's simplicity is hiding. This is where we really get to the heart of it. Which brings us to the big question, right? If all the information is right there in black and white, what's the catch? Why can't we just, use this as a guide? And this is where that whole illusion of simplicity just completely falls apart. Check this out. The antibiotic ceftriaxone. The chart lists it for both pneumonia and typhoid. Think about that for a second. You've got a high fever, you feel awful. Is it a lung infection or a bacterial infection in your bloodstream? The medicine might be the same, but the diagnosis is everything. Without it, you're just guessing. And it works the other way too. The chart lists 5 different options just for a fever. Why so many?
Well, because the right choice depends on what's causing the fever, your age, your other health conditions, and what other medications you might be taking. One person might need paracetamol, while for someone else, ibuprofen is a much better call. A chart can't possibly tell you that.
You know, there's a famous quote that calls medicine an art. And even today, in our age of data and science, that is so true. The science gives us all the medicines on this chart, for sure. But the art is knowing which one to use for which person at exactly which time. And that art involves diagnosis, experience, and human judgment. 3 things a simple chart can never, ever give you. So here's the crucial point. The main takeaway from all of this. Think of this chart as a map. It shows you the general landscape of diseases and treatments. It gives you context, but it is not a GPS. It cannot give you personalized turn-by-turn directions for your own health journey. For that, you need a guide, and that guide is a healthcare professional. So this leaves us with a final question to think about. In this age of instant information, our challenge isn't really about finding answers, it's about asking the right questions. The goal isn't to be our own doctor. The goal is to be a better informed patient. So use charts like this to understand the landscape, to learn the language, so you can have a better, smarter conversation with your doctor. Because understanding the limits of a simple chart isn't just smart, it's the first step to taking real ownership of your health.